Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. I want you to think about this today. What if real relief for your emotions and nervous system didn't take months or years, but days or weeks? Today's guest, Dr. Richard Chen of Focus Wellness, is a physician helping people calm their nervous system, stabilize their emotions, and feel like themselves again far faster than most expected. So like you, I'm excited to hear more about Dr. Chen and what he can do. But before we jump into the episode, I just have a quick message from our sponsor, Grow Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best, and that's getting your patients and clients better. But Grow Solutions eliminates stressors in the business such as new patient or client acquisition, marketing and growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs. And we even help you understand AI systems and which agents to potentially put into play in your business, because whether we like it or not, those bots are coming for us. So Grow Solutions is not an agency or vendor, we're your growth partner. So if you've ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow below and either myself or a team will get back in touch with you, or please feel free to DM me on any of the platforms that are out there. But you came here for a reason today, and that's to hear from our guest. Dr. Chen, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Thank you very much for having me on the podcast. Yes, I'm Dr. Richard Chen. I've been a functional medicine doctor in practice for 32 years, and I sort of reverse illnesses that aren't getting better by improving emotional and physical health with attention to COVID, using internationally well-known therapies with pretty good results.
I love it. I know we'll dive deeper into that, but so thank you for the introduction on yourself. But I do want to ask, kind of back in your history, was there a moment in your life, like a circumstance or something happened that said, I want to choose a career in medicine?
Well, I came into medicine the Asian way. My parents made me do it. But that's not. So I became a physician because my father was a physician and my mother wanted a physician in the family. But initially I was like, I did it because obligation wise. But there was one point where I had learned functional medicine. I was like learning this stuff there, and it was really, really cool. My daughter got born, and then when she started growing up, her first year of life, she had multiple food issues. And so, and if I hadn't learned what I had learned, I wouldn't be able to sort of like understand what was going on and have different ways of dealing with that there and stuff that there. So I think for me, so I came to medicine, to integrated medicine through a different pathway, but something that happened to my family made me realize this is the way to go, because, she had all these food issues and I actually reversed all those food issues. And so, she's doing pretty, really well. And now she's a college freshman. So, but it was seeing how what I did impacted my own family and my own daughter that made me realize this is the way to go. I mean, there's no other way to go. So, yeah.
Yeah, it's a great point. Unfortunately, sometimes we personally have to go through an issue, or like you say with your daughter going through an issue, that's what makes kind of a transition for us into looking at a different avenue than how we typically are originally practiced. So when you first started, you were you're a family practice physician?
Yeah, I was in family practice for like many years. I mean, I would sort of say probably from from 1990 to about, so like 13, 14, half my career was in family medicine. And so that's, using medications, 15, 20-minute appointments. It is what is medicine now, I guess.
Yeah.
So, yeah.
It's the unfortunate broad scope of medicine, but that's where a physician like yourself that leans into functional medicine, where you see the value of that. And you hit on one of the important parts, Dr. Chen, and that's where you talked about time. It's very, very difficult for the average physician in a clinic or in the hospital to take more than 7 or 15 minutes with them versus you yourself in your own private practice. I'm sure that, explain to us, like if I were to come into you because I had a condition, what's that, initial visit like?
Yeah, for me, the most important thing when I tell a patient is it's their story. That's the most important thing I can get from them. And so, I have them fill out a questionnaire, which can take a half hour, an hour to fill out, pretty much their whole life story.
Yeah.
And then when I see them, I spend my first visit usually an hour and a quarter. I spend 45 minutes sort of examining, talking to them, then maybe 15 minutes examining them, and then 15 minutes giving them the wrap up there. But I think you're totally right. I mean, I think if you have very limited time, you can't really think. You just think of the diagnosis, you think of the medication. You can't do anything else. So.
Yeah, very true, very true. So, what was it like the transition from family practice to the functional medicine? Was that your daughter's issue that truly made that transition?
No, actually, first is I'm a very curious person. I like learning, and so for me, my first conference I was called something called Food as Medicine in Washington D.C. And that's the first time I learned about food as medicine, which is kind of like an interesting concept, which is pretty basic and common.
Yeah.
But as a physician, I was like, it's just calories. Who cares what kind of food it is?
Yeah.
And there at that Food as Medicine conference, and they talked about functional medicine. I was like, oh, using the latest science to apply to current health. That sounds pretty interesting. So then I took courses over several years and got certified in that there, and that was the beginning of my integrative medical career and stuff. So
yeah, and I know you've used some specific techniques and things that you do in your practice, and I want to get to that. But before we jump into that, what do you think is kind of the biggest misconception that the general population, has about integrative and or functional medicine?
I think it's a good question, and I think what I think is I see it over and over again is people think it's the right supplement. It's like it's not the right supplement. It's like it's the right thinking. It's the right lifestyle, and you can do the right supplements. It's not going to be it's not going to be one magic supplement. So I think it's a combination of you need the right lifestyle, you need the right stress management, and then you can have a strategy for why you're using those supplements. It's not about there's one magic supplement. It's not a medication. It's not going to one magic supplement is not going to cure everything, but you have multiple issues going on there, and you have to use a strategy of why you're using certain supplements to make things better. And so
that's a great point. Everybody in typical medicine, people are looking for the easy button or the pill that fixes them. Then as you start to jump into integrative and or functional medicine, people are like, well, it's just a supplement. All I need to do is go into GNC and grab a supplement. Nothing against GNC. But there's more to it than just one thing. Typically, a plumber doesn't go to a home with just a plunger in his hand. Same thing with you as a physician in integrative medicine is that you're not just going to go with every single patient and say, okay, I've got 3 vitamins here. We're going to pick which one is going to work best for you. You're truly diagnosing that patient, especially listening in that conversation. So that leads me to think, what aspect of your practice do you think would really help others more than the typical family practice office?
Well, I'll tell you a story, and I'll tell you how that it makes me think what I'm doing is correct and what technique I did.
Okay.
So I had a guy. I saw him. I just saw him like this last week or so. He saw me 3 years ago. Okay. He had back pain for about 40 years, basically.
Oh my!
And I treated him with a technique, and I'll talk about the technique wise. And when I treated him with the technique and stuff like that, he didn't feel anything for like a month. But then a month later, all his pain went away. Okay, all his pain went away. Okay, and so for after 40 years, and then after what I did, he had no pain for 3 years, and he just contacted me last week. He's like, I don't know if this has anything to do anything with what you did, but I had no pain. I had pain relief after 1 month after seeing you, and it's totally gone. And I'm wondering whether you help me, and maybe I'll see you again, and you can help me again. I was like, I'm pretty sure what I did helped you, because there is no reason why, if you had back pain for 40 years, why would the pain go away? Because for coincidence, it doesn't work that way.
Right.
So
he walked under a rainbow. I think that's what helped him. I don't know if that was the case or not. I'm sure what you did do that. So I'd love for you to dive a little bit deeper specifically on that. I know you do some very interesting things with Alzheimer's in autism, but I'd love to hear about that technique that you helped the gentleman with the back
Yeah,
pain.
so this is it's called neurotherapy. So neurotherapy started in Germany. I forgot how long ago and stuff there, but basically, your whole nervous system is connected. It's like your brain is connected, your spinal cord, and everything's connected. And so for him, he came in for back pain, but he had multiple other issues, multiple other surgeries, had multiple other injuries there and stuff there. And I checked the areas that were injured and see where the nervous system gets affected. Because when you get injured, your body can heal from the injury, maybe a scar from a surgery, but the nervous system may not heal. And so what I did is I treated the nervous system, and classically it's done using injections of like a local anesthetic at a very superficial skin level. And that's what I did for him. He's like, I treated that skin area, but I treated other areas too. And so his system after, usually like with neurotherapy, you have immediate result, which is great, but it doesn't happen that often. It's very common to have the delayed results, like in his case, but his case was kind of interesting. Like, 1 month later, everything went away. So that was kind of cool. But the neurotherapy is like, I do another therapy too, but the nervous system and nerve therapies are just very, very, very satisfying, because if you get the results, they're life changing pretty much, right? So
yeah. When you have pain anywhere, and then you can get rid of it, it's wonderful. Especially back pain. We only have one back, so when it's there, So you helped him with back pain. Does that mean this neural therapy is good for joint problems or other musculoskeletal issues?
I would sort of say there's different therapies for that. There too, and so like that for people who have joint issues. There's another therapy called prolozone, which can be helpful in terms of like stabilizing ligaments or sort of actually helping regenerate cartilage. So it depends on what part. There's different therapies for different issues. So it's not like I wrote a blog one time called when you're a hammer. It's like if you only have one tool, you just use the same tool over and over again, but your body is not that simple. There's different things going on there, and you have to sort of choose the tool based upon what's going on there, and so.
Mm-hmm. Yeah, it's a great point. Kind of like I was saying, the plumber coming to a house with a plunger. You need more than one thing. So when you have all of those techniques at hand, it's great, because no matter what type of a patient comes in your practice, you have multiple ways in which you can help them. So we've spoken before this in the podcast, Dr. Chen, and I know that you do. I believe you're going to be starting a program helping people with Alzheimer's. Would you mind diving a little bit deeper into that?
Yeah, I'm really looking forward to starting this protocol. It's kind of personal to me because my father died with Alzheimer's, and both my grandparents with Alzheimer's and stuff there. But it's called a ReCODE 2.0 protocol. It was started by Dr. Dale Bredesen, who was formerly in California. I believe he's someplace else at this point there and stuff. But they just came out with a study. It was called a multi-center study comparing the results. I think it's called Avanthia study. Compare the Avanthia study to the leading Alzheimer's medications, and the magnitude. It's magnitudes better. There's 8 times more improvement with the ReCODE 2.0 protocol versus the leading Alzheimer's medication, which costs about $10,000-$20,000 per year. So just in terms of the results is just amazing in terms of what it shows there. So that's it's right now it's a pre-printed study, but it will be a pre-reviewed study, but it will be hopefully reviewed and printed pretty shortly there and stuff. So
okay, and again, that's a program that you'll start a protocol that you'll be following in the next few months.
Yeah, hopefully this coming month or so. I think the ReCODE 2.0 is a pretty good training because it sort of goes over they're just, I won't go over it all, but I would just say, there's it could be infection, it could be toxic, it could be, sugar issues there and stuff there. It's good review. And I think, with the fact that I've already been doing this for like half my career. So I think it'll be a good addition to what I do. And so.
Yeah, absolutely. So I know that you also do some very interesting things with individuals on the autism spectrum. Would you mind sharing a little bit about that with our guests?
Yeah, it's been pretty interesting. I've gone through the academy called Medical Academy of Pediatric Special Needs, MedMaps is on their website there and stuff. They're pretty good autism training, and so I've been doing that more recently in the last year or so. One of the things we talk about in terms of autism, and especially we heard in mainstream, is like the leucovorin. And it's like definitely there's multiple things going on with autism, and that's not the only thing. But in autism, 70% of people respond to leucovorin, and so it's really been satisfying. Like I just had a follow up with a mom like maybe the last week or so. They've been on that medication, that leucovorin, which is like a medication, but it's actually it's a prescription folate for probably about 6-7 months, and they're so happy with how their child is doing. He's getting communication. He's like understanding. He's understanding of comprehension of verbal comprehension is improving. His teachers notice it, and so they're like, so just realizing that you're making impact in terms of like affecting a child so that they can be part of society. That's cool, right? I mean, you're making a positive change for a family, and it's going to affect the next generation. So
yeah, absolutely, very rewarding work that I'm sure you're doing in that regards. From a patient that comes in with a parent, typically, I'm sure because of the autism issue, I'm sure it's difficult to express the expectations because they'll be different for each patient. Would that be true?
Yeah, I think it's a good point. I think I'm more of I'm almost in some ways I'm more like a mechanic. I tell them what's going on and tell them how I want to fix it, and then I don't know what's going to happen, but I have some general idea what's going to happen, but I let the results speak for themselves and then deal with that afterwards. So I don't have any. Sometimes you can have possible side effects, so I caution them about possible side effects. But it's a good point, sort of advising of possible positive side effects too would be a good thing too, actually. So
Yeah,
yeah.
absolutely. If you look back over your career, what would you say are the most common types of patients that you do treat from a diagnosis or conditions as they enter into your practice?
Yeah, for a while, this is what I was seeing. It was like, I was dealing with a lot of people with who were called empaths, people who are very sensitive to people's emotions, other emotions health. And I sort of realized I had the toolbox to treat empaths and their medical and emotional and physical illnesses because I understood how the body worked. But I mean, I think it's a very select population there. But I would sort of say in general, like it could be anything. It's hard to say, but I think what I do realize, especially, is the really importance of emotional health. I think in terms of I had written a blog on emotional health, and somebody with a psychology background is like, oh, it's very interesting that you as a physician talk about emotions. But then the more I've sort of done this work, I realize, I thought it was more related to people who are more very emotionally sensitive, but it's true of everybody. I mean, we all have emotions. Most of us do, anyway. Yeah. And if you don't deal with emotional stuff there, you can't get better because that's it's like a very deep, it's a very background item who's like, oh, what's going to affect my emotions? Like nothing's going to affect that. Well, it does. I mean, how your genetic background, your psychological upbringing, your family upbringing, there's so many layers going on there. And it's really important to sort of have the right emotional health because that affects your whole body, your whole mind.
Yeah. So I think this leans into a little bit about the emotional, but I think it might go a little bit deeper in that. But when you have patients that comes in to your practice, you probably they've seen many providers before you. And so they're like, okay, I'm at the end of my rope. Terrible analogy to use there, but that is something that they're doing. So are there ways in which you help them from a trust factor on saying, I know you've gone through this care before. This is why I think the path that you're going to take with me is going to get you better. So how are you building that trust when they've potentially failed with other providers?
Yeah, and I think that is a very good point, Wise. But I think the main thing what I do is, I sort of most people who have been sick for a while, they have multiple health issues going on there. And for me, it's sort of like figuring out what those health issues are and prioritizing them. And once I prioritize that health issue, I try to give them 1 or 2 things they can do about that first item to get them better. Because I could say anything, but if it's more like if they can see some results of what I'm saying is making sense and it actually has an application to their life, then that's how I build trust. Because at that point they've seen so many different doctors who said so many different things, more words is not the issue. It's more like, what are my actions and how does it affect them? And so that's so.
Yeah. Yeah, it's very good. And do you think mindset of the patient coming in is important for you to help them get better?
Totally. Oh yeah. I have other physician friends like who said talk about it's about I can bring all I have to the examination table itself, but if the patient is expecting me to be everything and them to do like very little, it's not going to work.
Yeah.
I can't go home with them. I can't prepare their food. I can't live their life. I can't live their life. And so, they have to be, I want somebody to be more committed than I am to their health.
Yeah.
If I'm more committed to their health than they are, that doesn't really go really well. So,
yeah, that's a great point as far as commitment in healthcare. And then thinking about insurance. Too often people think that insurance is their healthcare, and that's not the case at all. Your healthcare has to be a priority, and no matter what's going on, people have to look at it as that no matter what my insurance does for me, if I need more care, I should be still seeing that physician that gives me more care. And it's just too often that they're relying upon insurance for their healthcare when it's a completely different mindset that people need to take. And I think it's improving as time's going on, that I really do have to make an active role in improving my health and working with my doctor. You're exactly right. You can't do everything. There's stuff when they leave the office they still have to do.
Yeah, and I think it's a good point about the insurance thing. Unfortunately, the insurance is still a business, and they want to have a profit to their shareholders and stuff like that. But I think sometimes from what I do is like you have to invest your own healthcare outside of insurance, unfortunately. But that's the way it's set up at this point there. So
yeah. So just a question: in the way in which you run your practice and you talk to some of your colleagues, would you say that you're happier in your practice than some of them that are in a clinical setting or in a hospital setting?
Well, I would sort of say maybe I'll compare myself to what I was 10 years ago.
Yeah.
So 10 years ago, I was perhaps seeing a lot more patients, making a lot more money. But I think these days, I see less patients, but I'm more emotionally and spiritually fulfilled, I think. Because it's like unfortunately my wife works, so it's like, so finances is not as big an issue there and stuff like that. But for me, it's like I know. Spiritual and emotional fulfillment is part of what I do. I'm a physician. I'm help try to healthcare and involved the healer wise and stuff. Yeah. And so yes, finances is good, but in the end, I'd like to sort of like help people. I want help autistic kids communicate. I want to help people get rid of pain. So that's what drives me there. Is like I want to get people better, and also make a living too if I can too.
Yeah. Well, I think we're all offered that ability to make a living. What's interesting is I think the 10 years prior, or maybe how you were said, either 10 years ago or 10 years into practice, that was work. It doesn't seem like it's work now. It seems like it's more passion. Yes, there's work involved, but it's more passion work.
Yes, I would totally say so. Yes.
Okay. From a business perspective, you're a small business owner being in medical practice. What are some of the challenges that your practice has?
I've been thinking about this I've opened my practice about 5 years ago. I built trademarks, I built a website, set up scheduling stuff there and stuff. Unfortunately, I'm a better physician than I am a business person. And so I've been sort of realizing that there, and it makes sense. I was taught to be a physician. I have tons of training as a physician. How much training have I had as a business person? Not as much, but I'm getting there. And stuff like that. So but it's like you learn something about marketing. You learn about healthcare marketing is a totally separate thing than regular marketing wise. And then just in terms of learning website. I used to be really big into computers. Actually took computer programming for a while. So the website design is kind of interesting. My wife has a visual eye, so it's interesting. It's interesting, sort of like trying to get the business doing better and stuff.
Yeah. When you get the results that you get, people hear about it more. It will grow on itself because of the referral component as well. So a question from the practice perspective. How do you think AI is changing or hopefully helping, or do you think what's your take on AI in healthcare?
Yeah, I'm not an early adopter, you have to come. I'll answer that from that point of view there and stuff there.
Okay.
I mean, I looked at the AI. I think AI can be, if it's done well, can help quite a bit. You can have chatbots. You can have things. I have my scheduling is all based computerized. I don't have to do that at all and stuff like that. So I can imagine that the AI could be quite helpful in terms of doing that. It's the question like how best could we use it. They have AI transcribers. That'd be really cool. I've used that before, and that's pretty cool. Yeah, I think there's a big things you can do there. The question is how to use it and how best to utilize it to sort of like keep the human component there and not just make it all AI, because then you're just like everybody else there. And so yeah.
Yeah. AI is great, but I don't think it will ever be able to replace the human touch, the human interaction, the thinking it may be able to do. But if it can think of what somebody is saying, but it can't see how that person's expressing it. So as you go through your lengthy consultation with your patients, they can say something and AI will interpret it one way. You will interpret it the same way AI does, but you can see something different that's happening with them because of that one-on-one approach.
Yeah. I mean, I think definitely as a physician, I have multiple lenses through which I view things, and I think those different lenses is what helps me to get the results that I want and that the patients want there.
Yeah.
So, yeah.
Yeah. You had kind of spoke earlier about the gentleman with the low back pain. I'd love for you to share a story about, maybe one of your autistic children that you've taken care of from a success standpoint in your practice.
Yeah, I would sort of say, I think what I said before in terms of that, the fact that, that when I saw that mom, when she was in Southern California, she was like beaming, because basically, a child who was like, was not so great at school, and now it's understanding things, and the teachers are saying, wow, what's going on with him and stuff there. I think that to me is like, the happiness of the mother, and just hearing about how the child is doing this. I've had other stories in terms of where the child had said the first word, said mommy or daddy or something there. Like, that's that you can't beat that there and so that. So yeah. when I think the leucovorin is just it's sort of like the way how that works is like the folate and B12 is kind of the engine of the body wise, and in 70% of those kids they have an antibody against the folate receptor, so that folate isn't even there. And so when you put those high doses of a leucovorin, it sort of overcomes the immune response and makes it work. And so you're actually turning on the engine of the brain, basically the engine of the body and the brain. And so that's why it works. And so it's a really powerful thing. And like, that's only one tool out of all the things there and stuff. That's cool.
Yeah, you've got an amazing practice ahead of you for the people that are out there. So I'd like to ask you, what's the vision for your practice in the next 3 to 5 years?
I think for myself, it's like, I want to I want to serve more people. Okay. I have licenses in California, Massachusetts, and New York, but I have an educator license in other states as well too and stuff. And to me, it's like, the more I can get out there and sort of tell people what's available. I think it's like, they don't even know some things are available, reversal of Alzheimer's, treatment of autism, treatment of people who've been sick for decades. So there are things that are available to me. It's just maybe getting the word out there. Maybe, I wrote a book. I have a protocol for why I get people get better. And, hopefully maybe if I do well the practice, I can teach that protocol or something like that. So,
yeah, I'd love to hear that. We'll make sure that we add that link in the description so people can find out more about your book. And we'll put all your social contact links in there. But if somebody's interested, whether they're in California where you're at, or no matter where they're at, Massachusetts, I believe you said, in New York, if you could do that from a telemedicine standpoint, or they just have a question about what's your Alzheimer protocol like, or your autism, how would you like people to reach out and find out more about you?
Yeah, it's best probably to reach out via my website. Okay. My website is the long name is focuswellness.net, but the short name is drfw.net. So if they go to drfw.net, they can reach my website, learn more about myself. Then they can either book a 30-minute intro visit, which is free, or they can contact me through the contact form on the website there. I also have a phone number too, so that's on the website too. So that's
okay. Yeah. Again, I'll share those links for the people to do that. I've got 2 final questions for you here, Dr. Chen. It's been a blast to have you on here and learn for what you're doing. The first question is going to be from an overall health perspective. What's one piece of advice you would be able to give our listeners or viewers that could help them in a positive way for their overall health?
I think what I would say is pay attention to how you're feeling. I think sometimes we think about, we're concentrating on what's going on in life and what we have to do and stuff like that. And some people are, we learn not to listen to from ourselves because whatever reason it's there. But I would say, pay attention to yourselves because, your body can tell you a lot of stuff. Your mind can tell you a lot of stuff there, but you have to listen to it first. And if you listen to it, it's going to tell you there's some interesting stuff there. I mean, what it tells you and what it doesn't tell you is kind of very, very interesting. So,
yeah. Well, thank you. I appreciate that. I love these questions because I always get to hear in the minds of healthcare professionals what they think is great. I do my best to take advantage of what you say. I can't say implement everything that's out there, but it's always good information for our listeners and viewers. The last question, you've been a great guest here on the Prime Health Podcast. What would your definition of Prime Health be?
I think Prime Health is individualized. I mean, everything I do is individualized. And I would say it's not like perfect health. I'm not sure that, right now I'm diabetic. So, it'd be great if I'm not diabetic, but, I would say Prime Health is getting the best health that you can with the right kind of therapies that you want to use, whether it's medications, vitamins, supplements, or lifestyle and stuff like that, and getting to do what you want to do. And I think that's what it's a visualized answer. And you get to do what you want to do using the therapies you want. So,
yeah, love it. I appreciate it. And that you have a lot of therapies and techniques in your office, and we hope that some people go to check that out. But Dr. Chen, I want to thank you very much for being an amazing guest here on the podcast. You've got a very unique perspective, how you came into it, that I believe you said the Asian way into medicine with your parents going into healthcare and wanting you to be there as well. And then you've advanced along. You've had issues with your parents as far as they've had Alzheimer's. That's pushed you into that learning from a functional and integrative standpoint that you really wanted to focus on that, which you've got your protocols that you're doing. And then unfortunately, your daughter had some, gut and body issues when it came to food allergies and symptoms like that. And it made you dive even further. Those issues make you a fantastic physician because you know what it's like for somebody to be pain or experience that. You don't want that for people. So I appreciate that kind of road that you're going on along the way. And I tell everybody here that are the listeners and the viewers of the podcast, if there's one thing that Dr. Chen had to say, I know there's more, but if there's one thing that you think somebody should hear, please do share this with that. We would love this to be shared to as many people as possible. But if there's one person that you think you can change their life with, whether they have Alzheimer's or whether they have autism, anything like that, please do share this. Dr. Chen, as you can tell, is a man of integrity. He really does want to help people. So I appreciate that you having that as a guest of ours here. From a selfish perspective, I always tell people to subscribe to the Prime Health Podcast. We're always looking for new subscribers and viewers that come along the way. But as we wrap it up until next time, remember that true wellness is a journey that we are all on together. Now, whether you are taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. Again, Dr. Chen, thank you very much for being a guest on the Prime Health Podcast.
Well, thank you very much for having me on. It was a pleasure. I appreciate the interview and the chance to sort of